My name is Sherry Armstrong, and I slit my wrist.
Good morning, Nurse Ratchet.
Good morning, Dr. Heather.
You received a new patient today. Her name is Cherie Peterson. She's 33 and is on 24-hour suicide watch. She's presented to the ER at 3 a.m. this morning and was admitted to the psych floor at 5 a.m. You'll see bandages on her wrists, which she continuously takes off.
Okay, does she have any other medical problems?
Yes, she does, bipolar and depression.
How has she adapted to her diagnosis?
She does have moments when she feels as if she doesn't want to be alive. She's not able to hold a job. She also has one child, which her mother takes care of.
Is this her first suicide attempt?
No, it's her second attempt. Within the past 2 years, she's taken medications such as Xanax and Tramadol in an effort to overdose.
Does she express any verbal complaints about the suicide attempt?
Yes, she states she can't keep a job. She also states she's losing control of her life. She's been fighting constantly with her boyfriend. She's in room 407. I will be letting you know which medication she is currently taking and changes I have made.
Of course. Thank you, Dr.
Good morning, Mrs. Armstrong. How are you today?
Good morning, Dr. Bubbles.
Oh, my name's Buble, like the singer, you know. Buble?
Okay.
Yeah. This is Nurse Ratchet. She's going to be your nurse today. I'll come into your room this afternoon to check on you. Do you need anything before I go?
No, ma'am. I'll see you later.
Okay, I'll see you later. You have a good day.
Good morning, Miss Armstrong. My name is Nurse Ratchet. I'll be taking care of you today.
You can call me Sherry.
Okay, Cherie. You can call me Paige if you want. How are you feeling?
Okay, I guess.
We will begin by discussing your schedule. Is that okay with you?
Yes, that's fine.
Okay, I come in at 9 a.m. We can meet at 9:40 a.m. to discuss any problems you may have. Your doctor makes his rounds around 8 o'clock. He will be coming to check on you to see how you're doing.
That's fine.
Cherie, I noticed you're looking down and across the room. Are you feeling okay right now?
I just can't take it anymore. Nobody cares about me, and I'm all alone.
Can you tell me what it is that you can't take anymore?
Life in general, and what it brings to me.
What does life bring you?
Life brings a lot of disappointment from a lot of different people in my life. My boyfriend left me. I also lost my job, and I don't have any money. My child doesn't even look at me anymore, and now my mom has to take over and help raise him.
I know we haven't known each other long, but you seem very sad and disappointed about situations in your life. It is important for me to find out if you're safe. Do you feel like harming yourself or others?
At this moment, no, but I do when I get depressed.
Okay. Cherie, let's talk more about what you're thinking and feeling during those times of depression. What thoughts are you having?
Just giving up on life and cutting myself.
What brings up these thoughts?
When I really need someone to talk to and no one's there for me.
Do you feel nobody understands?
I know no one understands what I'm going through. I just try and solve all my problems in the only way I know how.
What other ways have you tried to solve other problems that have positive effects on your life?
I love spending time with my son, and he makes me very happy. But his dad makes me sick. I can't stand him.
Cherie, I noticed when you talk about your boyfriend you get upset. Can you tell me more about what you're feeling?
When the father of my child comes back into my life, it takes a toll on me. He was my first love, but he emotionally and physically abuses me. You see my bruises?
How long has this emotional and physical abuse occurred?
Since we first met, I remember one day he woke up from his sleep and he caught me on Facebook and accused me of cheating, and he punched me in my face and told me I was worthless.
How do you deal with the physical and emotional abuse?
I fought back, but it didn't change anything. I always stayed the same.
And what happened after that?
Nothing, I just stayed with him. I know that's not a reason, but it was a good enough reason at the time for me.
Is this when you became suicidal?
Yes, I couldn't cope with my issues any longer. I began to cut myself. I was very depressed that night with no one else to reach to. I took a razor and cut my wrist and laid in bed. My boyfriend came in the room and thought I was dead. When he realized I wasn't, he called me crazy and sent me to the hospital.
Have you ever talked to a counselor?
Yes, the counselors seemed to be helping until I got back with my boyfriend, and that's when the physical and emotional abuse started all over again. The suicidal thoughts began to multiply. I would like to start counseling again.
So you would like to begin counseling. What led to this decision?
Counseling made me feel better. I was able to see a great difference in myself. I made better decisions as I felt I was better equipped to handle the situation. In the end, he always seemed to corner and sweet talk me and begin to feel as if he loved me, and it made me feel better. But it only lasts just a short time, and then it's a cycle, and it just starts all over again. And I'm ready to end it.
Okay, it's good that you recognize that this has been unhealthy for you. Let's discuss the collaborative treatment plan we have initiated in regards to your care.
Collaborative plan? That sounds fancy. Is that special for me?
We have a long and short-term goals for you, but overall, our treatment goals are for you to be able to recognize unhealthy behaviors and utilize effective coping skills.
I understand what you're telling me.
First, we will discuss a no suicide commitment. This agreement outlines what you should do when you become suicidal. The objective of this is for you to establish the mindset that death by suicide is never okay. It also provides you with a list of resources should you begin to have a suicidal thought.
I will agree to sign your contract. I didn't know that there was places that would help me, and I feel like this. Decided that I didn't need to go. I know I wasn't very smart.
Your therapy will begin with the antidepressant Prozac. This medication works by blocking the chemicals in the brain that may become unbalanced. It is important to take this medication as instructed, which will be once daily. As Prozac can take up to 4 weeks before you are able to feel better, we will also start you on an anti-anxiety medication, also known as Xanax. This will be taken 3 times daily and will be used to manage and decrease your anxiety. This dose will be tapered down to PRN usage once we reach a therapeutic level from your Prozac. Do you have any questions about your meds?
Can I pop a top of that? You know, like have a beer or so?
No. No alcohol with these medications because a synergistic effect, depression of your central nervous system can be fatal.
Well, thanks for clearing that up.
You're welcome, Cherie. In addition to your medications, we will schedule you for individual counseling as well as group therapy. These sessions will help you to develop problem-solving techniques and appropriate coping skills. Your individual sessions has been scheduled for the afternoon at 3 p.m. It is a 30-minute session, but you're able to stay for a full hour if you wish. There is a group session scheduled for 10. Would you like to attend?
But Nurse Ratched, is there people that's going to be just like me in there?
Individuals in the group have been diagnosed with the same condition, and the groups are divided in this order so that you are with the individuals that will relate to your feelings.
I think that's a good idea.
Do you want me to set up your appointment with your counselor at this facility?
Yes, please. Let's make an appointment.
How about tomorrow?
Sounds great. I look forward to it.
You're welcome, Cherie. See you tomorrow.